besties. Welcome back to another episode of The Nurse Aspect, where we assess and evaluate. I am your host, Nurse Becca, and today we have on the show nurse practitioner Belinda.
Thank you. Thank you.
How are you?
I'm okay. Thank you so much.
Good. So we're gonna get right on into it.
Okay.
What made you get into nursing?
Well, it's a long journey, so let's see where I could start back. Let's start back. Young girl, always wanted to be a doctor or a nurse, had to be in the medical field.
Mm-hmm.
So did my 4 years at NYU, received my Bachelor of Science in Healthcare Management.
Mm-hmm.
After that, I actually got accepted to NYU School of Medicine.
Oh, wow.
Did 1 year and found out I was pregnant. And then I didn't go back because I was having like mommy stuff going on.
Oh.
So stopped because I was pregnant.
Mm-hmm.
Did so far so good. I said, you know what? I'm going to go back. Then when I decided to go back, they're telling me I had to do the MCAT over, I had to do this over. And I'm like, I'm not doing all that over. But
Was it like a long period of time?
yeah, they told me that I had to do all my sciences over because technically at that point, it was now 10 years old.
Okay.
So do the calculation of the age. Everybody's going to start adding my age soon, right?
Well, you look good. First of all, you look good. Black don't crack, so it's fine.
So I was like, all right, I'll do that. I said, I'll take the MCAT over. And I thought about it. And then my father was really sick in the hospital at one point, and there was this ICU nurse that was exceptional. I mean, when I tell you how she was able to quickly identify that he was going into like a congestive heart failure and he was septic, and she was able to like really just make sure she made that move. And she's like, saved my father's life. And then at that point, I'm like, wow. I said, nursing might be a go because we're like right next to that patient. We're the ones next to these patients. We're the ones being able to take care of these patients hand in hand. Not saying anything's wrong with doctors, but I'm just saying like we're right there.
Yeah.
So I'm like, she made such an impact on my dad and an impact on me that that's when I said, you know what, maybe if I shift a little bit, let me transition to nursing. And it's probably been the best move that I ever made. So fast forward, did my 4 years of, actually I did an accelerated program because I already had my 4 years bachelor's degree in all the sciences. So I did my accelerated program at Adelphi University. Worked in the ER for about maybe 4 years as a nurse practitioner. But after 1 year working as a nurse, I went right back from my nurse practitioner at Adelphi University.
Oh, wow.
Went back and did that. After I did that, I worked in emergency medicine. I was a hospitalist. I did GI. I worked in pain management as a nurse practitioner.
Oh, you've been around the block.
Oh, yeah.
You've been around
essentially,
the block.
I created my own residency, pretty much, right? You know
Wow,
what I mean?
no, for real.
So at that point, I said, you know what? This was cool. It was great. And then how I transitioned over to now doing psychiatry as far as a psychiatric nurse practitioner is my son was actually bullied in school, and he was actually suicidal.
Oh, wow.
And coming from the Caribbean, we know how mental health could be a stigma, or it could be a number of different things. But I always was that Caribbean parent, but not that Caribbean parent where it allowed my son to come and talk to me about certain things. So at first, initially, my first thing is to go to school and beat kids up. But you can't do that, right? So
I mean, we're not in the Caribbean now because Lord knows, Lord knows.
You couldn't do that. So I was able to intervene and not have to use violence, thank God. I had to speak to parents. I had to go to the school. And honestly, tell you the truth, I was able to kind of stop the bullying, per se, when I had a couple of friends that I grew up with from Queens. That just picked up my son one day from school. I said, just pick him up from school one day. Just make sure you guys
out.
look,
Just show out. That's it.
And, I picked the hoodest of all the hood boys that I know. Go pick up Cal for school for me real quick. And, of course, by culture, my son said, hey, Uncle such and such. Hey, Uncle such and such. And they're like, oh, my goodness, those are Cal's uncles? Never got bullied again. That's all I had to do. And now he's an awesome little boy. Well, not awesome little boy. He's going to be 20 in another 2 more weeks.
Oh, my gosh.
Yeah. So that was one of the things that kind of transitioned me. In addition to during right before COVID time, I had a friend of mine that unfortunately, was battling a lot of major depression, and we both knew, but she always, and I always tell people, hey, listen, check on your happy and healthy friends. I happened to FaceTime her in error. Like, how you do a pocket call? I'm like, girl, I got you on the phone anyway. So what's up? She was literally in the moment of taking her life. And I happened to FaceTime her.
That was not by error.
That was not by error. So that's when I knew psychiatry is also for me. And me transitioning from having a really good friend, battling, and then having a son, but both of them were also very comfortable, being able to tell me after the fact. So now, as a psychiatric nurse practitioner, I have my own private practice for like the past year. It's been doing so far so good. Myself and Valerie started off with maybe 35 patients. Now we have over 400.
Oh, wow.
Yeah, we have over
okay,
400.
come on, growth.
Okay.
Come on, growth.
Yeah, so it's been awesome. And we also just hired another psychiatric nurse practitioner.
Oh, wow.
But she's just dedicated for peds.
Okay.
So both Val and I can see pediatric patients, but our adult population needs us too. So we wanted to have someone just only dedicated to peds, and there's a need for them as well. So she just came on board. She's actually just started last week. So she's doing so far so good. And here I am today with you.
Okay.
What a journey.
You wrapped it up. That was like a New York minute. But let me, I kind of want to back it up a little bit. So like with your son, like what age group was he? Was he in like middle school, high school?
He was middle school. He was in
middle
eighth grade.
Wow. Wow.
Eighth grade.
Wow.
Unfortunately, we were in an area, unfortunate for, I guess, America, but, we were in a Long Island school district that's predominantly white. And my son was the very few black children that are there. So I pay taxes. My ex-husband and I, at that time, we are deserving to be anywhere we want to be. We pay taxes. We're not out here killing and shooting nobody. We're living an honest life, working, doing what we have to do. I save lives for a living. At that point, I wasn't even a psych NP, but I still save lives. I prevent, things from going forward. So no matter what aspect of nursing, you're saving life. That's what we do, So at that point, I really said to myself, I said, I have to really intervene. And he was so young, and he would come home, and he was, he would stay in the mirror, and I see him like pressing his flare like flat, like trying to like slick it down. And I'm like, what are you doing? He's like, oh, my hair's too curly. But okay, left it alone. Then one time he was in the shower, and then my ex-husband at the time, he goes, like, Cal, what are you doing in the shower so long? What's going on? And he's like, oh, my skin is dirty. What? He was washing so much that, he was told the skin was dirty. And mind you, the boy's probably more fair skin than I am, but your skin's not dirty. That's the pigmentation of your skin.
Right.
So a lot of things were coming about of that, so that kind of led on. And, with that school district, you start from like elementary, then middle school, then high school. So it's the same kids going all the way up. So given that when he graduated from high school, in honors, got accepted to NYU, and no longer suicidal for many, many years, loves his curls, loves his complexion, and has a significant amount of confidence. I think that's instilled from home, but the fact that he had to kind of go through that just because of the outside world is really sucks. But he did well. He did okay. I mean, I thank God that he was able to circle back. Yeah. Because sometimes, when people say, oh, you know what, suicide, people who think of suicide are so coward and it's so selfish. You don't know what pain that person is going through. You know what I mean? You just don't know. And me coming from a Caribbean background would have probably said that if I wasn't, knowledgeable about certain things and witness certain things. And knowing the type of world that we live in, it's unfortunate. And, we look at the fact of how many people they can leave behind, but they're not thinking about that. We always tell people when they're alive, you think about yourself. Think about yourself, think about yourself. The same sort of thought process when they're thinking about themselves, when that pain is so significant that they feel like ending their life. Right. We don't know what the pain is. I'm just here to help you prevent it. So I always tell all my patients, anytime they have any passive suicidal ideations, whatever it may be, I would rather hear your story than attend your funeral. So please, let's go. Yeah. You know what I mean? So yeah, definitely.
I mean, that's pretty, like that. Honestly, I feel like that's a testament to your character that, one, he was able to come to you, because I feel like a lot of times, especially in the Caribbean nature, like we don't go to our parents to say like, oh, this is what's going on. If anything, they're like, you're depressed them dishes. You know, they're not concerned about that. I sent you to school and that's it. Yeah, exactly. So the fact that he was actually able to even come to you, definitely speaks to your character. Yeah. So that's really great. And maybe you were kind of always meant for psych. So that's also pretty dope too. Like you walking right on into your favorite.
People always tell me, I come to you for advice. I was like, I wish I could take my own advice. I give you great advice. You know what I mean? I tell people, don't do this and don't do that. Maybe you should think about this, but it's never the pointing of the finger. I always try to circle back, like, if you care about this man or this girl, name me 3 things right now that you could say why you love her or why you love him. And we got to sit there and think about it too quick. I mean, it's not coming. Think about it. So I always kind of reflect back, though I'm trying to get my point across. I try my best to kind of reflect back, and I do that with a lot of my friends or, coworkers, whatever it may be. I wish I could do that for myself. Sometimes I don't even take my own advice, but that's how it is. You know how it is.
A nurse will always be a nurse.
Yeah. But I'm going to talk about the worst patients in the world. Even when I've had surgical procedures done and doctor be like, hey, listen, Belinda, did you do such and such? Nope. But did you do? No.
No, we make the worst patients.
I'm getting around to it.
Yeah, we make the worst patients.
Yeah,
we do.
I get around to it.
Yeah, that was me. That was me just the other day. I was talking to one of my friends who is a nurse practitioner, and I was just telling her my most recent lab results. And so, well, did you do this? Did you do that? And I'm like,
yeah, I get around to it.
No, I'm not, and I'm actually not doing it. So I don't even know why we have to, like, you as a nurse, you know the vibes.
Yeah.
Like,
we'll get around to it.
I'll be fine. It's okay. Okay. I'm actually going to work tonight, so for my 12 hours, so I'll be fine.
You'll be fine.
So, first of all, let's talk to me about your business. What's the name?
I was moving in new direction, Psychiatry. And we kind of just went ahead and just made an acronym called M.I.N.D Psychiatry. It's funny because Valerie and I had the first date when we were actually trying to figure out a name. So I was like, oh, something has to say mind in it. Something has to say minding it. So she's like, well, it doesn't have to really say mind. We could just figure something out. We tried all the names. A lot of names were already taken. And then she's like, well, how about, we got people who want to move in the right direction with their life or whatever. She's like, moving in new directions. I'm like, okay. And she's like, wait a minute. Each letter in moving in new directions stands for mind. And I'm like, you're right. I was like, you're brilliant. This is why you're my business partner. So this is where we came up with that. So we did this. It's funny because I met Valerie actually at clinical, during my rotation with school. She wasn't like a long-term friend or anything like that. So I met her while doing our rotation in our psychiatric practice. It was at another hospital in Brooklyn, and we learned a lot because it was one of those hospitals that's predominantly psych intake of patients. So, and I used to actually work there in the emergency department as an acute NP. So me having to now present to a psychiatry attending versus, presenting any case to a ER attending was very different. So, and the level of care, though the same, it's different treatment plans, obviously, Right. So we did that. We managed to kind of get through that together. She was at a different university. I went to my university. So after we did that, we said, you know what, after a year and getting our 3,500 hours, because obviously in New York, you cannot be independent until you complete your 3,500 hours. So I thought I was okay because I've been a nurse practitioner in, internal medicine and adult health before. That doesn't count.
Yikes. So you have to start.
I start over again. So I said, you know what? It's not as bad as 4 years of residency. So I'll take it,
Yeah.
So we did our 3,500 hours a piece. We both worked at 2 private practices as well. I worked at one practice in the beginning right out of school. And then I transitioned over to her private practice that she was at. And then I was there for a while. And once I hit that 3,500 hours, that was it. And then after that, I was actually done before her. So I went ahead and I said, you know what, I'm going to get everything started. So we got everything started. And then we just executed. It's funny because we got our corporation, our name and approval by like the state and everything in August of 2022. And then we kind of sat on it a bit. And then we were just seeing and just calculating how much we were giving to these private practices, how much we were getting paid out. And though it was a decent, salary, if you're getting paid.
Because I hear psych MPs do make money.
Yeah. So they do make, they will pay you, some hospitals or some, private practice can pay you easy $120 an hour, $130. That's good money. That's really good money. So we're like, wow. So if they're paying that to us, I can only imagine how much they're getting per patient. So we sat down and calculated. And then we have other practitioners that are nurses and NPs, rather, that have their own private practice, and just asking them about billing and ask them how much do they get paid per patient, even if it's on a primary care aspect. And the billable codes are still a little bit different, but somewhat the same. You know what I mean? So we started calculating. We're like, wait, so if they're paying us $150, but they're getting $500 for this visit, why can't we do the same?
Yeah.
So we asked around. We made some connections, and then we said we just got to just do it. And then we opened up in March 2023.
And never look back.
Never look back. 400 patients later.
Yeah, that is so amazing.
Thank
to
you.
Like grow from and I feel like that's great in terms of like it's just in anything that you do.
Yep.
You got to start. You're gonna start small, but you eventually it's okay. You can always grow. You can always grow. It's just about dedication, about moving forward. So that's pretty great. That's pretty great.
Awesome.
I can't wait to see where you guys are next year.
Yeah.
And congratulations, you just got an award.
Yes, I did.
Can you tell us what the award was for?
And I was excited. I was very humbled because I think with nursing, we don't get recognized enough because, unfortunately, the profession doesn't allow us to excel to that point because they kind of want to keep us to the low part, especially as nurse practitioners. A lot of doctors are not very happy that we're independent. And I'm not, they're quick to tell you, well, you're not a physician. I could have been you. I just chose not to. Let's not go there. And I know what I am.
Watch how you talking to
me.
Wait,
hold up. And also, too, we know that. We're not trying to take your job. We're just trying to practice, safe, medicine. If you can diagnose, so I can diagnose too. Now, I'm not going to go ahead and, perform, any kind of neurosurgical procedure, you know what I mean? But I feel like, we have enough knowledge, we're equipped enough to kind of practice independently. And if I am stumped on any question, I'm not going on Google like I see some attendings do. I'm going to an attending or a person that's a question, a direct question. Or I'm going on, peer-reviewed journal articles. I'm going on up-to-date. I'm going on websites that actually make sense. You know what I mean? I'm not going to just Google something.
Right.
So having said that, we're very knowledgeable. Our schooling is appropriate. I think it could be a little bit more stronger as the PA programs. The PA programs tend to follow the medicine model. So a lot of their structure and how their program is set up makes them, very strong out of school. So I feel like if some nurse practitioners didn't actually have an RN baseline in like the ED, the ICU, or like a telefloor, they may struggle outside of school coming out, because in school you're not going to be reading chest for x-ray interpretations, and you're not going to be doing all those things. I learned that on my own because I wanted to. I worked in the ED, so I would go and piggyback off these attendings, like, how do you read this x-ray, how do you do this, if you have this UA that came back like this, what makes it true positive of a UTI? You're not really getting that in school. Even suturing, we're not getting that in school. The PAs get that. So having said that, I just feel like we as a profession sometimes don't really get that enough clout the way we're supposed to, but we're moving little by little. So here we go.
Yeah. It's baby steps.
Yeah, baby steps.
So for me, I know that I used to always say that anybody that is working in psych, like I could not work in psych. Like that's just me. Like psych to me was like the bottom of the barrel. What do you find is like the biggest difference in terms of like medicine versus psych? Like what do you think is the biggest difference or biggest challenge to overcome?
The biggest challenge for me, and I'm sure a lot of other psych MPs and psychiatrists would say that, you don't have a stethoscope, you don't have an EKG to look at, you don't have labs to look at. All you have is from the neck up, okay? And you have to be really good and in tune with that patient to ask the appropriate questions to be able to get the most appropriate answer that you think you can get. If you're having someone who is more of an acute psychotic behavior, it's kind of obvious, maybe what they can be, if it's schizoaffective disorder, schizophrenia, if they're hearing voices, seeing things and things of that nature, then, you kind of rule that in. But for someone who's bipolar, you like, someone is just probably, they're just stressed out. One day they have elevated mood, then they're down. But when it's significant highs and significant lows, it's kind of hard to determine what's a significant high and a significant low. All you have is your patient and what they tell you, So we have our cues that we kind of tell us, hey, listen, if you're feeling down and out, if you're having, lack of interest, you're feeling this way, you're isolating, are you having these symptoms 2 or 3 times a week for like a 2-week stretch? Boom, okay, then you're clinically depressed, But sometimes, you have some patients that could have been going through something that time period, and then, and then they're not depressed. So I feel like the biggest challenge as far as between like internal medicine or even just medicine in general, or emergency medicine. Emergency medicine, I find it to be the easiest because they present to the ER. I have chest pain. Oh, I have dizziness. I have this. What you going to order? Maybe CAT scan of the brain. You're going to order cardiac enzymes. You're going to order EKG. You're going to order Chipotle. You're going to order a bunch of things. And once your labs come back and your imaging come back, this patient's in acute heart failure. This patient has an ischemic MI. They're going, is able to identify. You can't just do that with psych. You have to be able to relate to your patient, be able to understand what you're trying to look at, and also take the whole thing, as long as they're not under the influence of any kind of street drugs. You know what I mean? So, and that also plays a major role. And, for example, a lot of people think that they have ADHD, right? So they're like, oh, I have ADHD, I can't concentrate. You're probably anxious. If you're anxious, you're battling anxiety, you can't concentrate, you can't focus. You're going to be very jittery, a number of different things. So what I do is I try to look at the baseline problem and also look at the whole picture, because a lot of times you could get but so much in initial evaluation. That's why my initial evaluations are a little bit more. It's almost like I have 4 initial evaluations before I really get to a true diagnosis. Unless someone is presenting to me like really, really acutely ill, where they wouldn't be online with me. They'll be in the nearest ED. However, if it's a situation where they presented, if they're tearful, if they're presenting with classic depressive symptoms, then likely I would probably start them on something immediately. So it's really hard to kind of tell. And some people are really good. You have a lot of people with personality disorders. You have people who are very, 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 very good with being able to mimic other people and mimic other things where they have like this identifiable disorders. So it's kind of hard. So you have to do your best and make sure you're doing all this from neck up. You don't have any other interventions to kind of be able to diagnose this patient, but from what they tell you, how they present, and hopefully they're telling the truth. That's it.
I mean, I could totally understand what you're saying for sure. I will say, when I was doing my psych rotation just as a nurse, it's interesting. I will say it's definitely interesting. I don't think that, I feel like going into it as a student nurse, you're like, oh my God, is somebody gonna kill me? Is somebody gonna like you're looking around like, I don't want to look at nobody in the eye, too long, But I will say, like, hearing people's stories, it is interesting to see how people's mind are like working or not working, so it's interesting. I just think that it's not for me. I think that it's definitely takes a special person to be able to be in psych. This is like such a kind of random-ish question. I remember when I was in nursing school, people used to say psych NPs belong in psych because they're psych themselves.
Ah.
What do you think about that?
Yeah, I guess I can feel that way about some ER nurses and some, they say that about us because of the adrenaline and the highness and, kind of going. I always say a psychiatrist or psychiatrist may need a therapist, you know what I mean, on top of that. Not only because of their own problems, if they have any, it's more for the fact that it's heavy to hear people's heaviness all the time. That's what you do.
That's very true.
So you're hearing people's problems all the time. You're like, God damn. And you feel, and I'm the most empathetic person you're going to meet. And I'm very like, oh my God, you want a hug? Like, I'm one of those,
Yeah.
So sometimes I have to create boundaries because I have to realize patient, provider,
Yeah.
So I do feel that transitioning into a full psych patient, I think that's a possibility because you're hearing a lot. But that's where you also, as an individual, you have to realize that you have to separate work balance and, your career and home life, So I think that happens anywhere. Even if you could ask any ER nurse that's worked in ED for many years, it's burnout. That's why they don't say that. I was an ED nurse my entire career, so it's always an adrenaline. So when I see people like sitting down doing nothing, I'm like, you don't got no labs to draw? You don't see this patient? I would have somebody coming in for a trauma, then somebody's coming in with chest pain, then somebody has an acute GI bleed. And when do I get to urinate? I just want to use the bathroom,
Yeah.
So that alone, and not being in psych can push you to psych medications because of a significant amount of stress. And then, a number of, and burnout, serotonin level just get lower and lower and lower. Your dopamine continues to go high, but too high where it could put you into a manic state. We don't know, So having said that, I do feel that a lot of psychiatrists and a lot of psych NPs probably need a therapist on top of that. You know what I mean? But I had this one psychiatrist that I worked with. He was amazing. He was a neuropsychiatrist. He happens to be, he's brilliant. He's Haitian. He's great. And he was my, I knew him from years. And he told me, he's like, it's going to be your remedy for, not being like these patients. And I'm like, these patients, don't say that. He's like, well, I'm saying, having, mental health issues. And I'm like, what's that? Take lots of vacations. And he said, yeah. I said, okay, that's what I do. That's my intervention.
Because I was going to go on next question, like, what exactly do you do to balance it?
And that's my intervention.
Listen, I love a flight now.
That's a vacation. That's it. That's it. Vacation. I do work out. I do that. I do definitely. Your partner is a very big deal. The person that I'm dating right now is amazing. So we have lots of chats. We kind of go back and forth. And then sometimes I do spend a lot of me time. I do isolate for a good reason. Where I would just go and dine with myself. I would go to the spa by myself. I will legit just turn my phone off, even if it's for 30 minutes. I mean, off of everything. If I want to sit there and pick my nose, it's by myself. It's by myself.
So You're digging for gold.
Yeah, listen, girl, it's up there. It's up there. So I definitely do that. So isolation works, and I say me time, and I said you be able to embrace being alone, and that's not necessarily where you don't want to be around anybody. Sometimes you just need to just disconnect for a little bit.
Yeah.
So I do disconnect a little bit here and there. And then if I need to talk to someone, I know so many therapists, so it's very easy. But then, sometimes I'll call a friend, but vacationing is, and food. Food is I love to go out and eat. That's my therapy on shopping.
Yeah. Listen, retail therapy always helps.
Definitely, for sure. Definitely.
That's good.
Yeah.
Do you have like a tip that you would want to share to either your former self or a tip that maybe for an upcoming student nurse or maybe someone that's just trying to get into psych, if there's anything that maybe you would want to share that you felt like you would know, like, or have wanted to know?
Okay. What I would definitely say is that psych is not what the textbook makes it. Everybody thinks someone who's depressed is disheveled. They're not eating. They're not showering. Depression looks like you and I. It's very, 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 there's no description to it. And I always say to always check on your happy and healthy friends. And I say that to say that sometimes people are battling a lot and it's not always about you. Don't be so personal when someone is, isolating for a bit. It's okay. People are trying to get their lives together.
Yeah.
But I always say to yourself that if you're going into this profession and you feel like, the judgment calls has to totally be out the window. You know what I mean? We're in a universe where we're just totally seeing a lot of different things. If someone wants to transgender or start from born a female and now wants to be a male, you have to leave your thought process and your culture and the wrongdoing and what you think is wrong in your brain away. So I had to step into that arena and be able to take my personal thought processes and put them in the garbage because it's not about you. It's not about you. So if you're going to come across a lot of things, you're like, oh, shoot, is that what you did? That's what you want to be? Is that how you feel? Now, of course, if you have a psychiatric patient that's schizoaffective disorder, something like that, and obviously they're delusional or anything that may be, and they're telling you don't see a little person on the wall, No, I don't see that little person that's on the wall. You may see that person. Now, we're not going to feed into that. But just you have to come into this profession knowing that the judgment calls and feeling like you can, point the finger and thinking you could tell them what to do. No, you're working with them. They actually, you're working for them. At the end of the day, you're here to help them. That's one. But my main thing is that, checking on happy and healthy friends is important because people go in with the perception of psychiatry of seeing someone else walking the street that's half naked or someone who's depressed and looks crazy. Miss America looked like you and I. She jumped right off that building. You know what I mean? The CEO of Bed Bath & Beyond, GOAT, took his life. You know what I mean? We have Kate Spade, amazing. So you look at all these people, so you say to yourself like, wow, it's really real out there. And, and for complete transparency, you're looking at someone who was walking around 7 days a week suicidal. I lost my father about 4 years ago. And I'm always one to help everyone, do everyone, everything like that. So it was easy for me I was always a go-to person. I was always I'm the baby of all my siblings, but the big girl. So having lose my dad, unfortunately, him and I were very close. Growing up in a West Indian household, we weren't that close. But as I got older, he's like, I realized I was just too strict with you. I'm like, yeah, you think?
As every Caribbean parent, yes.
Exactly. So that was my ride or die, I did everything to him. I knew that man's last bowel movement or his meds, his last echo, the last time he was in the hospital, who was attending that tended to him, what his last EKG read, I knew everything. That was my father. So when he passed away, it was a hit. In the beginning, it was I was more like just trying to defend certain things. Like maybe it was me, maybe because I changed his meds, maybe I did this, maybe I did that. And I'm like, no, it just happened. So what I'm saying is that after when all the hype was over and everybody's checking on you and everything else like that, because everybody's around during the funeral time, everybody hears that they're giving you calls.
And then everyone leaves.
And everyone leaves, as they should. Back to life, right? You know what I mean? So, everything's over, but death is very final and death is there's no do-over, So, and that resonated with me like, I'm never going to see him again. Like, as much as I know that he would eventually, our parents get older, and as much as, and I worked through the whole entire COVID. I was doing death certificates for coworkers that I worked for and managed to get through that. But when it's your own, it's a whole different ball game.
Right.
So I just kept getting lower and lower and lower, and I just felt like I didn't want to be here because I felt like something was my fault. I just kept battling a lot. There was nobody could even tell you anything that I was going on with me. Nobody. And I had close friends because Belinda always has an answer. Belinda's going to be okay. Belinda's strong. She's that. Okay, I may be, but there's also, you're allowed to be weak too. You're human. I don't, when you cut my skin, it's blood that comes. I put myself on Lexapro. I got myself in grief therapy. I did all that on my own. And not one of my friends could even, I could be in a code thinking like, God, maybe I should be coded right now. I would say these weird things, like, because grief was hard for me.
Yeah.
And being able to identify, and the only reason why I think I'm able to have a conversation with you today is because of my son. Because I felt like, how can I do that to him? Because of what I'm feeling. And if my father was alive, I know he's up in heaven like, girl, if you don't stop your foolishness, you know what I mean?
Yeah.
And then I circled back, but I had to intervene.
Yeah.
It was with medication for me. I was on Lexapro for about like 7 months. And I did, therapy was more of the chokehold for me, because therapy I think is so amazing if you have a good therapist, because I think meds just kind of give you a level, to help boost those serotonins up to kind of make things, really heighten, kind of get you where you need to be. And as a nurse, taking them when I was supposed to, and I was like, let me just continue with therapy. Bad, you know what I mean? But then I weaned myself up appropriately, and I'm good. And that's why I tell patients too that sometimes life factors and external factors, life happens. So don't feel like medications, because a lot of people don't want to start meds. They're like, oh my God, they're gonna think I'm crazy. People are on medications just to help control their sleeping. Like, you know what I mean? But it obviously is an antidepressant as well. You know what I mean? So I always tell people that if you start on meds, it's not the be all end all. I'm a prime example, Therapy is good. I like when patients have both therapy and medication on board because it's a good synergistic combo, because though we advocate for the brain, we advocate for it very differently, as far as psych and peace. We're ready to treat medically. We're big about, medicine and obviously, controlling certain symptoms and chemically treating. Whereas therapy digs deep. Sometimes you don't realize you had some trauma that you dealt with as a kid.
It holds up that mirror.
Oh, wow. You're like, wait a minute. So that's why I snapped on that boy like that, because when my father told me, and as Caribbean, and I keep going back to Caribbean because a lot of things we say and we do, we think it's a norm, and it's really not.
It's really not. Yeah.
It's really not. And then even when I even ask for like an initial evaluation with certain patients, and I say, any abuse or trauma in the household growing up, physical, mental, or like, sexual, and they're like, no. And I'm like, wait, well, you are West Indian, because a slap is considered to be okay. But in certain other cultures or in certain parts of America, physical abuse would be that slap. Then I was abused. You know what I mean? But I don't look at it as abuse. You know what I mean? I mean, if you're getting hit with a hot frying pan across your face, that's something totally different. But my fault, like, yo, what? The belt will come out in a flash.
The belt is coming out immediately. Yeah,
you
knew what it is.
Okay.
Yeah, you knew what it was.
You know, it's like, oh man, here we go. You know what I mean?
Yeah.
Or even like my dad used to tell me, his theory was, if I call you stupid or say you did something stupid, it's going to automatically make you do better. And that you have to be mindful, because you're like, that was stupid. Why would you do that? That was stupid. How could you fail this? Are you stupid or something?
Yeah.
And I'm like, no, I'm not. And then I'll just do better. And I think that also played a role into adulthood.
Yeah.
People's like, yo, Belinda, what are you doing again in school? And I'm like, because I just want to go to school. And I've had situations where in relationships and with friendships, and I can have a conversation. And then, for example, my boyfriend be like, I didn't say you. I'm like, you think I'm stupid? He's like, where'd you get that from?
Right.
He's like, what is that? I'm like, circle back, B. And that comes from something so small as that.
Yeah.
And that also was something that was beneficial to me, but also could be almost like it could be bad in another relationship.
Right.
You know what I mean? So that's why I say that psych is not just, the Joker from, Batman. Because he was true psych.
Right.
But again, Joker they triggered him. Why would you messing with the man for? You come around making jokes and spitting. That's why he blew all y'all up in the damn train. Don't mess with the man. Leave him alone. Like, you know what I mean? So I can always say it's always cause and effect.
Don't mess with the people in the MCA that you be seeing in the subways. Don't mess with them.
Yeah, exactly. When I see schizophrenia people, everybody's like, oh my God. The society's a threat to them. They're not a threat to society. Leave them alone.
Yeah.
Leave them alone. So that's where we are today.
Well, thanks for the tip. Last question. Where do you see yourself in like the next couple of years? Like, what's the next move?
So
are there going to be installments of M.I.N.D Psychiatry?
Listen,
be like
that's the key, is to have multiple. So being that we are virtual, both Valerie and I are getting licensed in other states.
Okay.
So once we're licensed in other states, that's more patients, more people we can help, more people we could reach out through the comfort of your own home.
Yeah.
So the key is to get involved and get licensed in new states. We also want to go ahead and implement something called TMS, which is a lot of non-invasive type of interventions to help treat anxiety and depression. And being that it's now FDA approved, especially for treatment-resistant depression, that's another thing we're going to do. TMS is it's you have to be compliant for it to work, because you do have to come to the office 5 days a week, and you get these transmagnetic stimulation little cords put in your brain, and then it helps kind of almost like a zapping, you know what I mean, to that area. So some people actually use it, what they call brain rejuvenation. Some spas actually offer it.
Oh, wow.
Because it helps boost the mood. Some doctors actually use it for some of the Alzheimer's patients to help kind of get neurologically more inclined,
wow.
Things of that nature. So we want to implement TMS. The machine is a significant amount of money, but, that's another big goal. So you can rent them, hopefully, So TMS is another big thing. We're doing our ketamine now. And what we also want to do is now actually also start doing being like an injection facility, because a lot of patients tend to neglect, a lot of providers tend to neglect the schizoaffective and, schizophrenia population. They're not really deemed fit for virtual. That's why we don't take them. I've dealt with many of them, and I have no issues, but of course, the compliance can be an issue, especially some of them really need to be institutionalized all the time, or have an ACT team to come and see them. But a lot of it comes down to medication compliance. And there's so much medications that are out that they don't have to swallow a tablet every day. And they have injection sites where they can actually come to locations and get their injection for the week. Or sometimes some injections go as long as the half-life can go for almost 2 weeks. They come once a month or twice a month. So a lot of people don't want to be injection sites because they don't want to deal with that population. So having said that, a lot of times, is it a safety issue? If it's not, people just see like, oh my God, they're psychiatrists, schizoaffective disorder, they're dangerous. No, the community is actually a threat to them. Once they're stable, just like anybody else, they could be a bipolar patient, that could be a neurologist that's in the field, and he's about to perform surgery, but he has a manic break. Why is he more normal? Because he's a neurologist versus someone, you know what I mean? So having said that, that's another thing we want to do. We want to be an injection site. We want to implement TMS. We want to get more states. And then we want to start hiring some more NPs as well to just make it just grow and grow and grow.
Wow.
That's it.
Do you offer therapy at M.I.N.D or no?
We do brief psychotherapy. And I say that to say is because we focus so much on medication management that we automatically incorporate some sort of therapy in it. But I do have some patients that are like, I don't like my therapist. Can I talk to you? And half of the time when I'm talking to most of my patients, it turns into a therapy session anyway, especially if their meds are stable. Yeah. So we do incorporate it. It's just that we don't do dedicated therapy, which is like once a week for like 45 minutes to an hour. it's something that we thought about because you do have some psychiatrists and some psych MPs that do it, and they'll make their sessions an hour, and then they'll do the medication management along with therapy. So the key is that if we do that, we want to get some more people on board because there's some people just want their meds and they want to just go.
Yeah.
You know? So, and then we'll pick and choose who will want to do more therapy and then, you know, and actually incorporate with medication management. So that is something that we're going to consider. But right now, we're just doing brief psychotherapy.
All right.
Yeah.
And where can the people find you? Are you online?
Well, no. Well, definitely. Obviously, we have our social media page on Instagram, which is called M.I.N.D Psychiatry. Or you can go to our website. It's just www.choosemindpsychiatry.com. We have our numbers. Well, we're on Alma. We're in Headway and Alma. We're also on Psychology Today. And I think that's about it. Yeah.
For now.
Yeah, for now.
For now. All right. Well, thank you so much for stopping by.
Of course.
You're always welcome to come by. When you get some installments, when you get some coins and you want to share like what's new with mine, you know, whether the states you're in or countries maybe, you know, you got to manifest.
Listen, I'm telling you, I'm about to be out in Bali seeing patients and never know.
Listen, I love it. You be on the swing with your dress and we'll see you soon. I'll see you in 15 minutes.
That's all I need is 30 minutes with you virtually. You're going to get that mind right. But I always tell people, do not do it alone. That's what I'm here for. Let's do it together. I get it. If anything, and it's so funny. I sent a patient of mine the other day. I have to sometimes say to myself, patient, provider, because I get so cool with them. You know what I mean?
Yeah,
and sometimes it can be kind of sticky. So you have to be very mindful. You know, you have to draw certain, you know, lines with certain things. But I do have some patients where I think I saw something on recently on social media, and I don't know if you saw it. A lot of people see it where you have the two white men that are really cracking up with each other, and they just look like they're just laughing and cracking up. So the meme said, you must always be them. They must always be professional with your patient. And it shows the arrow of the two guys like laughing and cracking up.
Yeah.
It was super cute. And I sent it to a few of my patients. And one of my patients said she feels like when she gets online or she's talking to me, she feels safe. She feels like someone to identify with, you know, and she feels like she's not being judged. And I have a lot of transgender patients, male, female. And once you have one of them and they refer and they refer and they refer, they all come, I do not care what you do in your bedroom. I do not care how you live your life. I just want to make sure you're happy. If that's how you feel, if you like it, I love it. That's it. You know what I mean? If you feel that's what you are and you identify, I'm going to respect your identification and we're going to keep it pushing. As long as we're not psychotic and as long as we're not trying to take our life, and if we are, I'm still going to help you then too. But as long as we're stable and everything's good, we're going to continue. We're going to continue to rock out.
Them two old men cracking up.
That's it.
But thank you so much.
You're welcome.
If you guys have any questions, comments, concerns, email me at thenurseaspect@gmail.com. Like, subscribe. Y'all know the vibes. And we'll see y'all next week.